And to the big story now, ready for battle.
The state taking new steps to try and stop the spread of the coronavirus into Michigan.
The state health department activating its Community Health Emergency Coordination Center. And this move will help the state respond more quickly to any potential outbreak here.
And Detroit Metro Airport is one of 11 airports across the country where enhanced screening for coronavirus will take place. That
virus has now infected more than 17,000 people worldwide, killing 362 people. And today we're learning that the coronavirus has claimed more lives in China than the SARS outbreak. 7 Action News reporter Amira David joining us live. And Amira, even major corporations taking drastic steps.
We have stopped any travel to China, and we have also taken some pretty extraordinary measures with the people who are in China, so to protect them.
GM's president Mark Roy speaking to reporters about action in the face of the coronavirus. The automaker, just the latest company with a global footprint in China, to announce a pullback on its operations.
We saw a lot of people wearing masks.
The move comes as fear grows, even from flyers traveling domestically.
Maybe 5 or 6 people wearing the masks.
Travelers here at DTW beginning to pack an extra accessory with them as the death toll in the coronavirus outbreak exceeds that of the SARS virus. This weekend, the Department of Homeland Security issued new guidelines directing all flights from China and all passengers who have traveled to China within the last 2 weeks to be routed into only 11 airports.
It's probably not a bad idea to, restrict travel. It's probably one of the quickest ways stuff can spread.
One of those airports is DTW. Those who have been to the Hubei province near Wuhan will be subject to mandatory quarantine, while those who are from other parts of China could be asked to self-quarantine. As for coronavirus screening, CBP agents are tasked with facilitating the testing, responsible for identifying sick passengers who may present symptoms of a cough, fever, or shortness of breath. Those passengers are eligible for an additional layer of screening, at which point on-site CDC personnel will decide whether they should be brought to a hospital for further evaluation, which could include cough and blood samples or throat swabs. Now, given this enhanced screening, I did ask Customs and Border Protection if there have been any delays or more foot traffic when it comes to slowing things down with the operations in the airport. And they tell me at this point there has been very minimal impact. Of course, we're going to continue to stay on top of this story and bring you all the updates as we get them. For now, I'm live at Detroit Metro. Amira David, 7 Action News.
And we know a lot of people are concerned about the spread of this virus. Amira, thank you.
Minimal impact here, thank goodness. Here to update us on this viral threat, our chief health editor, Dr. Partha Nandi. And Doctor, people do feel the need to protect themselves. We see some wearing masks. Does that help?
So, Glenda, I get the concern, right? So many of my patients also are worried about how this might affect them. But when it comes to face masks, the typical surgeon mask, right, will not help much as they're not tight-fitting. So that means you could still inhale small airborne particles. As for the N95 respirators, if you're not trained on how to use them, they won't be effective. They can be hard to wear and feel claustrophobic. Plus, they only filter out about 95% of airborne particles. And on top of all that, the CDC is really not recommending any mask because the risk to Americans still remains low.
Yeah, that is some good news. The risk to Americans is low. But doctors, what can you tell us about the spread of the virus in California?
So, Alan, I'll be honest and say that I am concerned that there are more cases. But here's this. I do feel very confident that we'll be able to control and contain the coronavirus in 2019. Now, regarding the latest confirmed cases in California, one is a husband who passed the virus to his wife. He had recently returned from Wuhan, China, and at first showed no symptoms when he was screened at the San Francisco International Airport. But shortly thereafter, he developed a cough and a low-grade fever. And a few days after that, his wife showed symptoms. So now there are 2 reported cases of person-to-person transmission of the virus here in the U.S. Now, the other new case in California involves a woman who also visited Wuhan. She's the second case in Santa Clara County, but according to officials, the 2 cases are not related, which is good news.
So how many people does the CDC currently have under investigation in the country?
So, Glenda, the CDC updated its numbers today, and there are a total of 260 people under investigation. Of that number, 82 of them are still pending, meaning that specimens from these folks have been received and need to be tested. But the good news is that so far, 167 of them have tested negative for the coronavirus. And you know, if you really want to know what's killing Americans right now, it's the flu. There have been about 10,000 deaths so far in this flu season, and the numbers keep rising. So please, if you haven't had the flu shot, consider getting it to protect yourself and loved ones. We're going to stay with the coronavirus and let you know what's going on, but remember also that the flu virus kills as well.
And of course, Doc, we can't stress this enough. Always take good health practices. Wash your hands with soap and water for 20 seconds under hot water. And if you're going to sneeze, just do that in the crutch of your arm. And if you're sick, just stay home, right?
Alan's been listening to me. Thank you for repeating that, my friend.
Thank you for putting that into perspective for us, Dr. Nandi.
Absolutely.
You can track all of the latest information on the coronavirus outbreak and the efforts to keep it out of Metro Detroit on our website, WXYZ.com.